Colleagues, I rise today to offer a substitute to Senate Bill 27. This bill would propose that we conduct or that we allow counties to conduct investigations of the nursing home policies of our governor throughout this pandemic. And I have news for you, in case you haven't noticed, but there's already been significant study and examination and investigation into this matter. In fact, there's been more than one investigation. Republicans have been looking for a smoking gun on Whitmer's handling of the coronavirus in nursing homes, and the data doesn't indicate there is one. If that sounds familiar, it's because it's in a headline today in MLive. And I just want to point out that the reporter has gone through and made a clear explanation of the data that has been uncovered in multiple studies, citing multiple experts. And I'm just going to read a couple of excerpts from that article. Michigan is below the national average in nursing home deaths for COVID-19. It is below the national average in coronavirus death rate among elderly people, regardless of whether they lived in a nursing home. While the COVID pandemic has been horrific for nursing home residents across the country, there's no evidence that Michigan has been hiding data or is an outlier in its handling of the situation. That's the beginning. And since I only have 5 minutes and it's a long, in-depth article that's very thorough, I am only going to read a couple of spots. I'll skip to a little bit later. On 2 different metrics, Michigan is slightly below the national average in regards to nursing home deaths. The death toll per 1,000 nursing home residents and percentage of total COVID-19 deaths attributed to long-term care facilities. On the latter, about 31% of the state's COVID-19 deaths are attributed to long-term care facilities, compared to the national average of 34%. Republicans are ignoring the outsized role played by transmission rates in the communities where nursing homes were located, say those who have studied the outbreak data. Experts say the big problem has not been patient transfers, but asymptomatic and pre-symptomatic transmission by nursing home staff who come in and out of facilities each and every day. The industry experts and those who have delved into Michigan's nursing home data to push the investigation, the push to investigate smacks of politics, not policy. Michigan Senate Oversight Committee held hearings. A state task force was convened to look at the situation, and a think tank affiliated with the University of Michigan did its own analysis over the summer. They all concluded that mistakes were made and there were lessons to be learned, but those largely resulted from how hard and fast the pandemic hit in March of 2020, leaving nursing homes and the state scrambling to react to a highly contagious and deadly virus that nobody had encountered before. Others go on to say, this comes from someone at the University of Chicago. I've seen no evidence, no good evidence that those policies in Michigan had changed anything or had any effect on COVID-19 outcomes in nursing homes, said Tamara Konecka, a University of Chicago expert in geriatric public health. I could go on. There are more and more examples. There's more data. I urge you to take a look at it. Today, my amendment, instead of providing those dollars that belong to the people of Michigan for investigations that have already been done, that will turn up no wrongdoing. Instead, my amendment would put this money into the things that we need most. It's been 88 days since the Trump administration signed legislation that provided states with COVID response dollars. In Michigan, we in this body have yet to allocate all of that funding. This money is for vaccines, for testing, money to keep families in their homes, to put food on people's tables. Money's for businesses that are trying to survive during the pandemic, and you are holding it up. This is not our money. This money is meant to help our constituents, the people of Michigan, not to be used as a political weapon. Let's stop the political games. Let's do our job. I ask that you support my amendment.